Hello, and welcome to Your Money 2.0. I'm Thomas Fox, Community Outreach Director of Cambridge Credit Counseling. Just about everyone in our country has an opinion about healthcare reform. But no matter where you stand on the subject, I'm sure we all agree that healthcare costs are way out of control. According to the Kaiser Family Foundation, healthcare costs have risen substantially over the last several decades. Healthcare expenditures in the United States were well over $2.2 trillion in 2007, more than 3 times the $714 billion spent in 1990, and over 8 times the $253 billion spent just 30 years ago in 1980. In 2007, U.S. healthcare spending was about $7,421 per person and accounted for 16.2% of the nation's gross domestic product, among the highest of all industrialized countries. Gross domestic product, or GDP, is the sum of consumption, investment, government spending, and net exports, which is comprised of exports minus imports. Consumption is generally the largest GDP component, and for good reason. The category consists of household expenditures in the economy, including purchases of durable goods such as appliances, cars, and home furnishings, among others. Also included are non-durable goods such as groceries and services such as healthcare. The investment component includes business investments in equipment, while the government spending factor includes the sum of government expenditures on the salaries of public servants, military purchases, and a host of other expenses. Exports represent gross exports, which are goods and services produced for other nations' consumption. And finally, imports represent gross imports, goods and services created by other countries for our consumption. As you can imagine, 16% of the total gross domestic product is a pretty big number. For a comparison as to how the United States stacks up against the rest of the world, the Organization for Economic Cooperation and Development reports the global average for spending on healthcare is $2,984 per person, making the U.S. expenditures 2.5 times higher than the rest of the world. Hospital care currently accounts for 31% of U.S. health expenditures, but the lack of discernible cost controls in this category makes it seem like the Wild West. Costs regularly go unchallenged by most patients and insurance companies, prompting many advocates to call for a change in the mindset of healthcare consumers. In other words, they want us to actually act like cost-conscious consumers, not passive victims of the current system. The logic behind this approach is that consumer-driven healthcare based on greater price transparency would make patients more aware of what they're spending for each product or service they purchase, thus saving all of us money. Now, I know many of you may say, this is why I have insurance. But the higher the bills your insurance company has to pay, the higher the premiums will be for you and me. It is the cost of doing business. As expenses rise, healthcare insurance companies pass those increases along, resulting in higher costs for everyone. In the beginning of March, CNN's American Morning aired an original series, Healthcare: Prescription for Waste. And although I only had 1 cup of coffee in me as I watched these installments, the information was far more jarring than any amount of caffeine. Many of the reports by CNN correspondent Elizabeth Cohen made a powerful argument for each of us to do our homework. Just as it's important to keep an eye on our credit card statements, it's equally important to pay attention to our hospital costs. According to the reports, almost $1 trillion is lost each year on wasteful medical expenses. Here are a few alarming examples. According to Cohen, a hospital once charged a patient $1,000 for a toothbrush. Another crazy cost, $140 for 1 Tylenol tablet. On one bill, a hospital charged $23 for this, an antiseptic wipe, an item that probably cost them less than 50 cents. But wait, that's not the crazy part. The hospital charged the unsuspecting patient for 44 of these. That's right, $1,012 for 44 antiseptic wipes that could have probably been bought at a drugstore for less than $20. Why does this happen? Insurance companies aren't very vigilant when it comes to looking at the details of bills under $100,000, making charges like these more likely to slip through. Another interesting focus of the CNN series was on the inconsistent pricing of similar medical procedures at different hospitals. For instance, The report looked at several relatively common procedures and did some comparison shopping. Cohen examined the cost of a colonoscopy at 2 facilities. One charged $4,991 for a relatively common procedure, while another charged just $2,800. For a hernia repair, one hospital charges patients $13,409 per procedure, while another charged $4,547, a difference of $9,000. As for quality, healthcare appears to be the exception to the rule of you get what you pay for. Of the procedures mentioned in the series, the quality of care was comparable. The only difference was how much each patient was charged. What can you do? It's simple. Comparison shop for your healthcare. This will require a little legwork as prices are not generally posted. However, call around to suitable healthcare facilities and do some digging. While many of these expenses may indeed be paid for by your insurance company, in the end, we all pay for higher healthcare costs. Well, that's it for this edition. We welcome your feedback and ask for your thoughts and suggestions by emailing us at yourmoney2@cambridgecredit.org. Thank you for watching. Until next time, I'm Thomas Fox for Cambridge Credit Counseling.